Why music therapy is a good treatment option. What is music therapy? Music therapy has been proven to help people psychologically, emotionally, physically, spiritually, cognitively, and socially. Using music to reduce stress, improve mood and self-expression. This includes listening to, singing, playing instruments, or composing music. It is defined as the use of music and its facets to improve, restore, or maintain health. What can music therapy improve? It can improve things such as lowering blood pressure, improving memory, enhanced communication and social skills through experiencing music with others, self-reflection by observing your thoughts and emotions, reducing muscle tension, self-regulation, developing healthy coping skills to manage your thoughts and emotion, increasing joy, behavior disorders, mood and anxiety disorders, ADHD, autism, trauma, substance abuse disorders, managing physical pain, increasing motivation. Music therapists are people who have backgrounds in music and professional schooling with at least a bachelor's degree in music therapy. They will ask about music background preferences of the clients to assess the needs and strengths of the individual to make sure the music therapy is most effective. They work with people such as military service members and veterans, people with autism disorder, individuals with Alzheimer's disease, people in correctional settings, victims of trauma and crisis, those who are physically ill, individuals with mental health disorders, people with chronic pain, and substance abuse users. Is music therapy the answer? Now that we have discussed what music therapy is, how it is similar to and different from traditional talk therapy, not only does music therapy help with mental pain, it is also used to improve physical pain. Plus, who doesn't like music? Music therapy versus talk therapy. Music therapy's main focus is music. The therapists have at least a bachelor's degree. They use the same technique over and over again, and they are usually recommended to by a therapist or a counselor. Talk therapy, on the other hand, its main focus is talking, validating, and guiding through the issues. The therapists have at least a graduate's degree. They use different techniques to solve the issue, and they suggest interventions like music therapy. But they both work together to reach goals. The physical treatment of music therapy. Unlike regular talk therapy, music therapy is also used for patients in hospitals suffering from illnesses like cancer, going through unbearable pain. In this case, music therapy works by directing attention away from the pain or anxiety and focusing it on the calming music, which is conditioned over time through repeated practice. This is very commonly used in teens and children. Stress. Dealing with physical pain in the hospital brings a lot of stress. Not only does stress bring down your mental health, but it also can cause health problems. These health problems include headaches, anxiety, appetite change, chest pains, depression, and more. Due to the cause of the hospital, Due to the cause of stress, music therapy is more important while being in the hospital, as music is one of the best remedies for stress. Calming music leads to comfort and relaxation over stress. According to Psychology Today, all forms of music may have therapeutic effects. although music from one's own culture may be most effective. There are 4 types of music therapies: compositional, improvisational, receptive, and recreative. Compositional music therapy is where you compose music, both lyrical and instrumental, and this is used to boost confidence in clients with low self-esteem or clients who are grieving. Improvisation music therapy is song creating. The therapist will interpret the mood based off the sounds and lyrics created by the client. This forces clients to make decisions who may struggle with confidence or self-expression. It's also used for those who are dealing with trauma or events they don't want to talk about. Receptive therapy is where the therapist will play music while the client responds as a way to express their thoughts. It's used to calm nerves for clients with anxiety, also used for those who suffer from hearing or memory loss. Recreative music therapy is where the client recreates what the therapist plays. This is used for clients who struggle with developmental issues. How does music therapy work? Music affects 4 aspects of the brain: attention, emotion, behavior, and communication. First comes attention. When music starts to play, the focus is taken off of everything else and all attention is put onto the music playing. Next comes emotion. The type of music played will either affect the emotions in a positive or negative way. After that is the behavior. Music therapy brings out movement patterns which affect things such as walking or speaking, which also affects communication. Music gets patients to communicate either non-verbally or verbally by affecting their behavior. And there's a brain diagram on the left on how music affects your brain. In conclusion, music therapy is described as the use of music to improve mental or physical health. It is based off of how music affects the brain, which the rest of the body responds to. Music therapists are specially trained as not just anyone can create music to help people heal. A lot of people like music and not many people like pain. So, would you consider music therapy as your form of treatment? And then my references. Thank you.